Hey everyone, it's Candace again. Um, Giving you another update just on how I'm doing with my travel assignment. So I'm getting closer and closer to the end now. I just finished my, oh my goodness, 10th? No, ninth week? Yeah, because I have about 3 weeks left and I have 12, yeah. So I just finished my ninth week. um, and it was, I'm definitely tired. I worked on Monday, Tuesday, and Wednesday night. Well, it's currently Friday morning, but I was off Thursday night, Friday night, and Saturday night. Um, so yesterday, work night for me was, very rough. I'm always pretty tired after that third night, and it seemed everything that could go wrong was going wrong during my shift. Of course, everybody was super, super nice, which I always say as long as the patients are nice and pleasant and, appreciative of what I'm doing, uh, it it honestly makes the job so much easier. Like I feel like I could do anything, handle anything that happens and they throw at me. Um, so it was just kind of a lot of little like tasky things, I guess, that I needed to do. First of all, it kind of started out as like a busy shift. It's always hard to like catch up if your night kind of starts off really busy because you don't really have time to like settle yourself and kind of make a plan for the night and settle your night. If it just hits the ground running like that, you kind of just me personally it just makes me feel kind of like, oh my gosh, what is going on? I'm overstimulated. There's so much to do already. So I started out with I had basically three patients to start off with. Two of them were like postpartum readmits, so were discharged from postpartum after they delivered, and then they were readmitted for complications. And then I had a patient who was about 28, 29 weeks pregnant. And then I was getting a new mom and baby, so a new couplet. Um, and so when you know that you're going to get an admission fairly early in your shift, you kind of try to, at least on nights, you kind of try to get everybody else settled first, like go and check on them, give them their meds, make sure they're good, so that way you can kind of put all your attention on your mission when it comes. So that's what I was trying to do and attempting to do. Um, but just the timing, I think, was off, and then just certain things that needed to be done, and, you know, stuff that wasn't where it's supposed to be. It's just little things. And then my new patient got there, and she, oh, sweetest people, sweetest people. But I felt so bad for her because she wasn't able to go to the bathroom. She wasn't able to pee. So usually after a mom has a baby, usually during labor they will have a catheter put in. If they get like, epidural, they'll have the catheter in because obviously the epidural is meant to numb you up basically so you don't feel the pain. So if you get that, then after delivery, we want you to be able to pee, of course. And sometimes it's hard because your legs and stuff are still waking up. Sometimes you can be very swollen, in pain. It makes going to the bathroom a little bit more difficult. So usually if that happens, then we do what's called a straight cath, which is basically the same as a catheter, but we're not leaving it in long term. So it's basically just put in to empty the bladder, take it out, and then you get a whole another chance to try and pee on your own. So usually after your catheter's out or your bladder's emptied, we give you a full 6 hours to pee or void by. So this poor mom, she wasn't at her 6 hour mark yet, but she was definitely feeling very uncomfortable and having a lot of pain. So in the postpartum period, if the so I guess you could see it as like your bladder is here and then uterus is up here. So if your bladder is continually filling with urine, with fluid, it is pushing up on your uterus, and your uterus isn't able to contract down where it's supposed to be after birth, and it can cause a lot of cramping, discomfort, pain, and then just also the feeling of having a super full bladder and you can't pee, which I'm sure everybody can understand what a super full bladder feels like. So, and that's why we're so adamant on like, we need to, get you up to pee, we need to empty the bladder, because if you're not able to and that uterus can't contract down where it's supposed to be, that increases your risk for postpartum bleeding or postpartum hemorrhage. So that's why it is so important, and why all of the postpartum nurses are kind of on you, maybe a little bit annoying about having you get up to go pee, because it really does make a difference. So this poor lady, she couldn't pee, and she was trying so hard, and doing straight cath is just not, it's not fun for either. Obviously it's not fun for the person getting straight cathed, but it's really not fun for nurses either, especially in postpartum. There's a lot of things that we can do, of course we're trained to do, but it's just things that, we really don't like to do, or it's not our favorite thing to do. Like with the catheters, we only really do catheters in postpartum if there's a problem, like can't pee or other reasons, things like that. So we don't do it, hopefully, very often. The same thing with like starting IVs or drawing blood or anything like that. We just don't do it often. We can do it, but it's just not as often as, say, like labor and delivery. So, that being said, she couldn't be. We ended up needing to straight cath her. And she, oh my goodness, she was so swollen. I felt so bad for her. But that is probably the main reason why she couldn't go pee, was just how swollen she is. There was just no, there's no way that was happening. So, that was the first thing I had to do when she got there. I had to deal, with her not being able to pee, and then had the baby as well. So the baby was a little bit cold when she came. And usually for our temperatures for babies, it can vary between hospital to hospital that I've seen, but usually roughly like 97.6 is the lowest we want the temperature to be, and the highest is usually between like 99.8 to 100 is what I've seen at most hospitals. So this baby was 97.5 for her temperature. So usually our treatments for low temperature, of course, we want to start with skin to skin. Skin to skin with mom is best, because skin to skin is actually so great and so beneficial for baby. It helps with so many things. Obviously temperature, blood sugar, how fast baby's breathing, heart rate, helping them just get acclimated to the outside life. Skin to skin is amazing. So anytime moms are able to and up for it, we always recommend skin to skin. But that's usually one of our first lines of warming up. My voice is cracking so bad. I'm so sorry, guys. But usually that's one of our first lines of trying to warm a baby up, is doing skin to skin. So I was trying to warm this baby up, put her skin to skin with mom, and she needed to eat anyway. And mom was breastfeeding, so that was perfect. But then of course, she was having all the problems with getting up and trying to pee and all of that. So, so sorry. Oh, anyway, so it was just battling all that at the very beginning when they came. And then, of course, the other patients I had, one of them had, she just came up from surgery, one of my postpartum readmits. So I had to go and get her settled back in really quick. Obviously, make sure she's good, breathing right, doing okay after surgery. Um, One of my other postpartum readmits, she was on a lot of antibiotics, so I needed to get those going. She was also in a lot of pain, so staying on top of her pain medicine. And then my still pregnant lady, of course, she needed her NST, or it's like fetal stress test that we check. Basically, where we're looking at baby's heart rate, we're monitoring how reactive they are. So um, I guess just kind of, I don't know how to explain that very well in like layman's terms. Um, but yeah, activity, like just making sure they respond correctly. They have like little jumps and dips in their heart rate, so it's like a waveform, so it kind of just looks kind of jumpy like that. It's the best way I can explain it. I'm sorry, guys. It's hard to explain it in like an easy and understandable way. But anyway, I needed to do that on my other patient as well. So there was like that, probably from like, so that new patient I got, that new mom and baby I got at like around 9 o'clock, and I was probably running back and forth between all of those rooms until maybe like mm, one, maybe one or two. So I didn't really it was just I had a brief moment, like maybe 30-45 minutes to kind of sit down and chart some. Thankfully, I try to chart in the rooms sometimes, especially if I get a new patient. I will try to chart as much as I can in the room, so they're kind of all sort of done, and I can let them relax a little bit and then go back and do my other patients' rooms. Um, but uh, so I was able to sit down for a little bit, chart, and then I was back and forth in between rooms all the way pretty much until shift change. Um, so it was rough. I didn't really eat last night. Um, I mean, what did I have? I think I had some crackers. I had some saltine crackers and some pistachios. Was pretty much all I had throughout the night. But it's okay. Some nights are just like that. You just get crazy, crazy busy. And I mean, and there were people to help, of course, but I feel like every time someone would ask me, I was like already kind of at the end of fixing a problem. Oh, and the lady who we needed to have a catheter in to help her pee, her IV also blew or infiltrated. So um, basically, it's where the IV comes out of the vein and the fluid starts going into the tissue around it, so it starts swelling up really bad. Um, so that's what was happening, and she was on IV antibiotics as well. So she needed a new IV. My lady who came back from surgery, she needed a new IV. Um, it was just a busy night. It was a busy night. But like I said, that happens. Everybody was helpful, willing to help. I am probably the worst person to ask. I did ask for help when I needed it, like when I really felt like I did. But I don't know. I'm just I'm very bad about asking for help. Like, I just don't want to put something off on somebody. Like, I just like doing my own work, which Sometimes I know I do it to myself, but um, and other times, like I said, it's just like by the time they ask, I'm like already past what I really needed. And if all I really need to do is chart and catch up on stuff, then they can't really help me with that. So yeah, that was that. But it's okay. It's okay. I'm getting there. Ready, definitely ready for a break. I'm trying to remember what I work next week. I think I work Sunday and Monday. I think I'm on call on Thursday or Wednesday. One of those days. And then I think I work Saturday. Saturday and Sunday. I really need to look. But I do know I have these next 3 nights off, so I'm not like, it's not super essential that I look right now. Um, but yeah, that's on the work standpoint, that's where I'm at. Home standpoint, of course, I am still just chilling here. I went and picked up a Walmart order tonight, you know. I got Wingstop, which was so good. So good. I've been so good about not eating out while I'm here, guys. Food is my definite biggest expense. I love food. I may not look like it, but I love to eat. I love all kinds of food. And as I've gotten older, I'm more open to trying like new kinds of food too. So I've been trying very, very hard to like just get stuff to make myself at home. So I'm not spending money on getting food. So I've been really good. This is actually the first time I've had, nope, not second time. I also got some Taco Bell one week. But still, second time out of almost 9 weeks. So I don't feel too bad. It was so good though. So there's that. And then not much else, honestly. Still, listening to 2819. Church is great. Working on myself, really. Still just chugging along. But I will keep you guys updated. I will, I know it's probably been like over a week since I think my last video. I'm trying so hard. I'll try to be better. I just, nights still just makes me feel, I'm just so tired all the time I just feel tired. But that's okay. God gets me through. So thank you guys for listening. If you want to leave a comment, like, subscribe, do whatever, I would really appreciate it. To all my friends and family listening, I miss you guys. I love you guys. Can't wait to see you again. And I'll talk to you guys next time. Bye, guys.